Classification of joints. Joints can be classified in two ways. The first is a histological classification and the second is a functional classification. The histological classification is based on the dominant type of connective tissue in the joint, and the types are fibrous, cartilaginous, and synovial. The functional classification is based on the amount of movement permitted in the joint, and the types are immovable, which is called Synarthrosis, slightly movable, which is called Amphiarthrosis, and freely movable, which is called Diarthroses. Now, usually the fibrous joints will be a Synarthrosis, a cartilaginous joint will be an Amphiarthrosis, and a synovial joint will be a Diarthrosis. However, there are some exceptions which we will see later. Coming to the fibrous joint. Fibrous joint is immovable and has no joint cavity. It can be divided into three types. The first type is called sutures. Sutures are seen in the cranium, and the connecting fibrous tissue in the joint are called Sharpie's fibers. The second type is gomphosis. It is seen in the teeth, and the connecting fibrous tissue is called periodontal ligament. The third type is syndesmosis. Now, syndesmosis is an amphiarthrosis. Usually, a fibrous joint, as we discussed earlier, will be a synarthrosis, immobile joint. However, a syndesmosis is an exception of a fibrous joint, which is an amphiarthrosis. A syndesmosis maintains integrity between long bones. The examples are tibiofibular syndesmosis between the tibia and fibula, and the radio-ulnar syndesmosis between the radius and the ulna. Coming to cartilaginous joints. Cartilaginous joints are based on the type of tissue or the type of cartilage into primary cartilaginous joint, which is also known as synchondrosis, and secondary cartilaginous joint, which is also known as symphysis. The cartilaginous tissue in primary cartilaginous joint is hyaline cartilage, and the cartilage in the secondary cartilaginous tissue is fibrocartilage. The primary cartilaginous joint is further divided into two types, temporary and permanent. Example of a temporary primary cartilaginous joint is epiphysis and the joint between ilium, ischium, and pubis in a pediatric population. Permanent primary cartilaginous joint connects bones without movements. So this is a cartilaginous joint which is a synarthrosis, whereas cartilaginous joints are usually amphiarthrosis. The example is the first sternocostal joint between the sternum and the first costal cartilage, and the costochondral joints in the ribs. Secondary cartilaginous joints are made up of fibrocartilage. These are thick and strong, and they have the ability to resist pulling and bending forces. These are amphiarthrosis and can be divided into narrow and wide symphysis. Example of a narrow symphysis is the pubic symphysis. An example of a wide symphysis is the intervertebral symphysis or intervertebral disc. The manubrium sternal joint is also an example of a narrow symphysis. So we have to remember sternocostal joints and costochondral joints are permanent synchondrosis, whereas the manubriosternal joint is a narrow symphysis. Coming to synovial joints. Synovial joints are usually freely movable and they are known as diarthroses. Based on the type of movement, they are divided into 6 types. The first type is hinge joint. It allows movement only in one plane. Examples are elbow, knee, ankle, and interphalangeal joints. The condyloid joint allows movement in 2 planes. It is also known as an ellipsoid joint. In a condyloid joint, there is a shallow depression at one end with a rounded end of another end, and the examples are metacarpophalangeal joints. The saddle joint is also a type of biaxial joints. However, here both bones will have both concave and convex surfaces, and the only example is the first carpometacarpal joint. So it becomes an important question. Now, what is the difference between a condyloid joint and a saddle joint? Because both are biaxial. So in a condyloid joint, one end will have a shallow depression, the other end will have a rounded end, like in a metacarpophalangeal joint. Whereas in a saddle joint, both the bones will have both concave and convex surfaces. And the only example is the first carpometacarpal joint. Okay. Fourth type is the planar joint. In a planar joint, as the name suggests, both the surfaces will be flat. It allows multi-axial movement, that is movement in multiple planes, but the movement will be restricted. The example is acromioclavicular joint, intercarpal joint, and intertarsal joint. Fifth type is the pivot joint. It allows rotation in a single axis. The examples are atlantoaxial joint and the proximal radial ulnar joint. The sixth type is a ball and socket type of joint. It also allows multi-axial movement. The examples are hip and shoulder. So both planar and ball and socket allow multi-axial movement. However, the movement in a planar is restricted, whereas the movement in a balls and socket is free and it is not restricted. So this is the difference between a planar and a ball and socket type of joint. Thank you.